Good morning, everyone. Good afternoon. Welcome to this fourth webinar of the series of health talks on food systems that WHO is organizing to discuss the feasibility of delivering food, healthier food, through the health system. Today, my name is Luz Maria de Regil. I am the unit head of multi-sectoral action in food systems within the Department of Nutrition and Food Safety at WHO in Geneva. This particular webinar is going to be dedicated to the role of the civil society action in program delivery and advocacy, and in particular to healthier food banking, reaching vulnerable populations. For 5 consecutive days, we have been discussing the role of the health system that can play as a platform for delivering healthier foods to those with economic and health vulnerabilities due to diet-related non-communicable diseases. We have had a very positive response from all our speakers that are experts in their field, and the series have more or less 35 participants. So it has been a major effort trying to bring everyone together to discuss the regulatory, programmatic, and financial implications of this novel approach. Of course, we always have said that the health system has a responsibility of guiding and providing the guidance for healthier food, but using it as a platform, of course, there are multiple challenges and multiple opportunities. So that has been the scope of this week. Before we start, let me walk you through a couple of housekeeping notes. So the first is, of course, that WHO convenes these webinars to have a conversation on emerging topics, on topics that may have global significance. We try to have a global perspective of how the different approaches are working in different countries, taking into account the local context. But of course, the views and opinions expressed during the Health Talks webinars are those of the speakers and do not necessarily represent the views of the WHO. Many people have asked whether we are making the presentations or the recordings available. The answer is yes. The recordings will be available on the WHO Food Systems Community of Practice website. You have the link on the screen, and I'm assuming that you have already joined the Community of Practice. If you haven't done so, please join. And if you are already a member, please share your insights, your information that the different organizations are generating, because that's a way that we build a better global knowledge on how to improve and make food systems healthier. And the last point, please use the Q&A box on the bottom of your screen to ask questions, which will be taken into account and discussed at the end of the webinar during the Q&A session that, as I said, is going to be at the end of the webinar. Today we have a couple of speakers, a couple of presentations, and we will have a panel, a moderated panel, and all the questions will be at the end. And let me just start by saying what we have covered in the previous webinars and the conclusions. In the first webinar, we look at the evidence behind delivering interventions through the public health system or the health system. We discussed tailored medical foods, prescription of vegetables and produce, prescription of healthier foods or grocery vouchers. So we discussed the feasibility and evidence behind several interventions that can be prescribed by health care professionals or accessed through the health system. We discussed evidence on non-health outcomes, health outcomes. And the conclusion of the webinar is that all that research suggests that the health system not only has a responsibility, but is feasible to deliver certain types of interventions to reach vulnerable populations, and that improves both health outcomes in terms of diet-related non-communicable diseases, but also non-health outcomes resulting from saving days in hospitalization or improving the assistance to work, etc. So it seems that there are positive outcomes, and there is enough rationale to make enough kind of a business case to consider the health sector as a platform for improving the health of vulnerable populations. Of course, there were some gaps in evidence, continue demonstrating the health, the cost effectiveness. We also look at that the evidence is mostly coming from the US at this point, or from high income countries. So we need to have more global evidence to make sure that there is a proper contextualization of these interventions. And qualitative research, of course, came up as an important consideration to start assessing the feasibility of strengthening the health system in this direction. The second webinar explored more what it takes to create a program, from the evidence to the program. And we discussed the readiness of the workforce, the health workforce, to prescribe this type of interventions. The question is, who will prescribe these potential interventions? So we discussed that in order to be successful, an initiative like this, it needs to have the health workforce, not only physicians, but the spectrum of the health workforce needs to be better trained, not only in nutrition, but also in culinary practices, to make sure that it's not only about the food, it's just not about eat more fruits and vegetables. Preparation, because food is so much into part of the culture, it needs to be respond to the local characteristics with good culinary practices, and it goes slightly beyond the health sector, but health professionals need more training in this area. And in some cases, I mean, of course, there are no dietitians, so it needs to be more creative on how to do it. We also discussed the health procurement framework and how it is being using the WHO healthy food procurement framework for procurement of food and services. Has been used by multiple organizations. Many of them are already have standards to improve the healthiness of food. And we discussed how some hospitals, particularly in the US or other settings, are using it to deliver healthier food. Having the adequate parameters for healthiness is very important for healthy food. And of course, complementarity with food safety is critical to ensure that the safe of the food, but also with minimizing waste in the process. Yesterday, we discussed on some of the governance mechanisms. It's clear that many of these efforts need to be led by the governments at higher level in order to be successful. But more important, that the government plays a critical role in bringing public and non-state actors into the conversation, ensuring that everyone has a role and everyone can contribute. Hence, health needs to be put at the center of many of these efforts. And today, as I was mentioning, we are exploring the role of the civil society, not all the responsibilities from the public sector. And today we are going to hear examples of different places how the civil society really can play a role in making sure that the most vulnerable populations actually have access to healthier food. This is not longer about food security, but about nutrition security. So today we are going to start with Katrina Lomberg, who has been a consultant in the nutrition department, and you will present about the subnational and local governments in ensuring affordable and healthier diets. Yes, Katrina.
Thank you very much, Liz. And as was mentioned, I will be presenting on the role of subnational and local governments in ensuring affordable, healthy diets. Thank you, Lilia. Next slide, yes. So to give a bit of background on food systems and how this all fits in, various factors shape today's food systems and determine access to affordable, healthy diets. This is because food systems determine directly the food security and nutrition by determining the availability and relative prices of nutritious foods that support healthy diets. So improving local food systems through policy to improve access to healthy diets is supportive of the achievement of both food security and nutrition, and also several sustainable development goals relative, whether it's directly as for Zero Hunger, SDG 2, or indirectly with SDGs 3, 10, and 11, and several others as well. Next slide, please. So just to give a bit of background, what do we mean by healthy diets? So only recently, WHO came up with a new joint statement with the Food and Agriculture Organization of the United Nations on what we mean by a healthy diet. So a healthy diet needs to be adequate in essential nutrients to prevent deficiencies and promote health without excess, balanced in energy intake and energy sources. It needs to be diverse and include a wide variety of nutritious foods within and across food groups. And also it needs to be moderate in consumption of foods, foods, nutrients, or other compounds with detrimental health effects, such as sugar-sweetened beverages or highly processed foods. And within all of this, food safety is key, as we cannot have a healthy diet without safe food. Next, please. So the State of Food Security and Nutrition in the World report is an annual global report led by FAO, but also supported by WHO, UNICEF, World Food Program, and IFAD, that monitors the Sustainable Development Goal 2, specifically targets 2.1 to end hunger and ensure food security, and 2.2 to end all forms of malnutrition. The most recent report, published in July 2024, found that hunger still affects 9.1% of the global population, and an estimate of 28.9% of the global population are considered food insecure in 2023. So malnutrition, as we see on the right figure as well, also remains a challenge globally, with most of the targets not being met or not on track to being met, though we have seen some improvements. Next slide, please. The reports also found that, also examined malnutrition and food insecurity by a degree of urbanicity or across urban, peri-urban, and rural settings. They found that both moderate and severe food insecurity are higher in rural areas than in urban areas across most regions, except for Northern America and Europe. But trends vary slightly by country income groups. So we see that in high-income countries, there are higher levels of food insecurity in urban areas than in rural areas, whereas most other regions may find the opposite. And for malnutrition, stunting, and wasting were generally higher in rural areas, while overweight was more prevalent in urban areas. But this is mainly to show that different forms of malnutrition may be more or less an issue across all localities. Next slide, please. So the most recent two reports raised key challenges and opportunities for local governments to ensuring food security and nutrition for all. The 2023 report, which looked at urbanization and its effect on food systems, highlighted the key role that local governments can play in formulating and implementing policies that go beyond agri-food systems and also outside of normal government administrative borders. In SOFI 2024, we looked at financing to end food insecurity and malnutrition. And the report highlighted the misalignment between the financing and local priorities, and it pointed to the need to put local actors and their priorities in the driver's seat. Next, please. So there are key food system factors that affect consumption of healthy diets. And on the right here, I have a figure from the SOFI report. It's a bit small, but I'll say the figure out loud as well. So the first one depicted here in the figure is the cost and affordability of a healthy diet. The most recent report found that 35% of the global population, representing about 2.8 billion people, were not able to afford a healthy diet in 2022. And when we talk about cost and affordability, we also need to raise the relative affordability of healthy and nutritious foods as compared to less healthy, highly processed foods that are high in sugars, salt, and fat, which also drives food choice. Next, the availability of nutritious foods within the immediate food environment is also key. And we find that some areas may not have as high a density of healthy or nutritious options available. These are often called food deserts, or they may be inundated with a high selection of predominantly unhealthy foods or food swamps. Vendor properties, so the kinds of foods that are available, the kinds of shops that sell foods and their food offer is another key factor, food system factor, and the marketing of unhealthy or highly processed foods also drives food choice, as does desirability and convenience. Next slide, please. But we know that there are also other factors that are outside the food system that determine food choice. And this can include employment type and income, or housing accommodation, both with respect to the cost of food relative to the cost of housing, and space as well for food storage and food preparation. In addition, fuel and energy availability and costs may play a role as to what kinds of foods might be prepared, especially at home. Next slide. So why do we talk about local governments? So countries globally have seen a wave of decentralization of governance from national level down to subnational or local level. So localities have more responsibility and power to make choices and in the protection of public health and more responsibility. Subnational governments are also closer in contact with local stakeholders and the recipients of the programs that they implement. And so they can ensure that policies are adapted to local conditions. And usually subnational or local governments are responsible for implementing national programs. So they will be more able to identify bottlenecks and issues and address them efficiently. So putting national and local actors and providers in the driver's seat is key. So this is just an overall figure from a WHO report on the food systems actions. So to highlight that WHO recommends a package of policy actions across food systems to improve diets. However, several of these policies can also be adapted at local level. Next slide, please. Depending on jurisdictional powers. And these cross food supply, food demand, and in supportive environments. I've highlighted in bold those related to social protection, also as well as those related to food assistance programs, as that's something that will be discussed later in this webinar. But some of the key actions include setting criteria for food provided through these food assistance programs, for example, to ensure that a minimum amount needs to be nutritious foods. Public food procurement and service, which Lou's already mentioned earlier and was discussed more in detail in a previous webinar, as well as food and beverage reformulation. On the food demand side, local governments may regulate food and beverage marketing in specific settings, which has been done, for example, in transport settings, or using behavioral insights to encourage healthier choices. For supportive environments, local governments have used land use planning tools such as zoning to limit, for example, the choices of unhealthy foods in certain areas, or to ensure that there's a higher availability of nutritious options, or by providing breastfeeding friendly environments, clean water, and specifically to the urban context, urban agriculture. Next slide, please. So key considerations for localities that and what local governments can do and how effective their actions are will be determined by several factors. The first one, which has already been mentioned, is the competencies in jurisdictions. So what action will be taken depends on the governance of cities, and that differs by or by localities in rural areas, for example, and that differs by area. So as an example, if we look at cities, many manage urban waste, but they don't normally oversee agriculture, the food that comes into cities. The next is financial capacity. So related to that, while authorities within a sector may be divided across levels of government, they may not necessarily hold the purse strings. So even if a program is run at local level, national funding may be driving that, so they may not be as flexible in that regard. Another main issue that is relevant is the connectivity between rural and urban areas. So the degree of connections between areas that, for example, produce food or predominantly purchase food shapes the food system. So the availability of affordable and healthy diets are also shaped, and so are the livelihoods of urban and rural primary producers, processors, and traders. And lastly, as with national policy, power dynamics within the urban governments within rural governments or any locality will also play a role. So national actors, there are multiple actors across sectors. They will all have their own ideas of how things should be addressed, and this needs to be considered as well. Next slide, please. Next slide, please. Oh, it's not. Oh, it's showing. Oh, sorry. I thought it was lagging. Yeah, no worries. Okay. So what are opportunities for local governments? One area is to build bridges in policy coherence, and this is both horizontal and vertical. So local governments, they may not have a direct jurisdiction over food production or certain nutrition policies that may be more at central or national level. So it'll be important for them to coordinate their interventions across different scales, also to ensure that there is coherence between national and subnational policies, for example. So local governments have been able to also influence the national policies, and so there has been a bidirectional kind of relationship between the two. Subnational governments are also important actors to formulate and implement coherent policies that go beyond food systems. So, for example, to go into housing or transportation, which may be related to food, but not necessarily under their direct jurisdiction. And lastly, and they are also encouraged to take a food and all policies approach. And this means to ensure that in other policy areas, food is also considered in policymaking. These policies don't need to be new policies. So local governments can also capitalize on their existing programs to incorporate nutrition considerations. But key challenges, as in any work, would be the conflicting priorities across sectors. So there may be different priorities within the Department of Agriculture, Health, Environment, or whatever, and that aligning those interests will be key. In addition, limited resources as well as bureaucracy. Next slide, please. Thank you. So the other opportunity for local governments is their convening power. So local governments really can use multi-stakeholder governance mechanisms such as food policy councils to involve various actors that are going to be directly involved in either delivery or in advocacy for certain local programs, such as civil society, who will be joining us in this webinar today, or private sector academic institutions. But with this, it's a key that power imbalances and conflicts of interest are managed well. And so ensuring that these align with shared principles and goals, and that there is transparency in policy making will be key to ensuring that all voices are heard as well, and power imbalances don't unduly affect the process. So next slide, I think is a summary. Thank you. So in general, food systems are complex and multi-sectoral. Food insecurity and malnutrition need to be addressed holistically, so across all levels of governance and sectors. And local governments can use their proximity to policy beneficiaries to identify bottlenecks and context-specific solutions as well. So there are several policy actions that they can take to improve access to healthy diets and support local initiatives. And local governments can use that convening power to gather the stakeholders around the table and identify best fit solutions for their given context. Thank you very much.
Thank you so much, Katerina, and thank you for reminding us that we have been talking more about national governments, but a lot of the action related to improving food systems goes through the subnational governments, and certainly they have to balance multiple priorities, but still there are multiple entry points to do the right thing for nutrition. With that, I have the pleasure to pass the microphone to Charlie Worthington, who is the lead of Food Systems of Consumers International. That is an organization that, of course, advocates for the rights of consumers in different areas. So, Charlie, over to you.
Thanks very much, Liz. Thanks all for inviting me and for organizing this really excellent series of events. Hopefully you can see my screen okay. Just bring up a couple of slides. So the topic of consumer action for healthy food sometimes maybe brings to mind thoughts about consumer choice, about purchasing power as a vehicle for change. I think the main message that I would hope to share today is about the fact that obviously while purchasing power is very significant, it's often very heavily constrained by the many barriers consumers face to accessing healthy, sustainable food. And that when we think about consumer action, it's really essential that we also think about the role that consumers can play as a collective, taking social action in transforming the food environments, transforming the conditions under which we all access food. So as was mentioned, I lead the food systems program at Consumers International. We bring together consumer groups in more than 100 countries around the world. I've been doing this for more than 60 years. We work on not just food, but also energy, circular economy, digital rights, consumer finance, and our members at national level often have a similarly kind of broad portfolio, which creates some challenges in terms of prioritization and the wide scope of work that affects consumers, but also a lot of opportunities. There's a lot of overlap between these sectors, chances for win-wins. So there is a particular value there to this consumer action approach to food policy and healthy food environments. So I'll come back to that a bit later. I'll work on food, kind of similarly broad, ranging from access to adequate food through to promoting healthy, sustainable diets, thinking about fair and inclusive food networks and supply chains. So Consumers International operates at the global level, whether that's bringing together our members to run multi-country projects or representing them on the global stage through partnerships like with the World Health Organization or engagement in international forums and processes. But my major focus today is on the work of our members, as I mentioned, more than 200 in over 100 countries at national level, who are really doing this work on the ground to shift food environments, and again, in many cases, have been doing so for decades. Just as Consumers International is a network organization, often our members are themselves networks either of local consumer groups around the world or of individual consumer actors across the country brought together into these networks. So before I get into some of the examples of what these consumer organizations are doing, what our members are doing, I just want to discuss a couple of points on why we're focusing on consumer action in particular, and as a kind of subset of social action more widely, why consumer action as well as more than just purchasing power, as I mentioned. The first point, hopefully an obvious one for this audience, obviously advocacy has a huge role to play in transforming our food environments, our food systems. Those who joined the other health talks this week or really engaged with any of WHO's work in any way will be well aware of the really strong evidence we have already on the necessity and the impact of food environment policy change. We've got evidence on the science, we've got evidence on how the policies work in practice, and yet in many cases, progress remains slow. Governments are not always uptaking even the actions that seem like kind of win-wins, like some of the easier wins for advancing nutrition. There's a few reasons for this. Obviously, financing, technical capacity is a big one, but also significant is that the best researchers are not always the best advocates, and that policymakers are accountable primarily not to science, but to the public, to the population, to consumers. And these are both areas in which we think that consumer advocacy, consumer action can really help to unlock some of these barriers and accelerate action on food environment policy. Second point, consumer voices can also often open doors that other advocates maybe can't. Regardless of scientific or technical expertise, having this consumer representation, working with consumers on the ground, as mentioned in the point below about this connect between people and policymakers, by combining this expertise with close interaction with consumers around the world in communities who are facing these challenges, consumer organizations are often really well placed to bring some of these perspectives to governments. And then finally, thinking to the future as funding models for independent policy advocacy become, I mean, as we all know, more and more stretched, consumer action as a collective interest group, there's a strong potential for more sustainable and self-sustaining action, even when funding and availability and support for kind of professional third-party expert advocacy becomes difficult. It's not a silver bullet by any means, but there's a model there that we think has lasted for a long time and has the potential to continue being a really powerful way of driving change. So my focus today is more on the how of consumer action than the what. I think we're all pretty aligned, hopefully again, in this audience on what are the changes we need and the challenges, how do we get there. The traditional model of consumer action is focused very much focused on these first 2 points, information and education. to, I guess, inform purchasing power, as discussed at the start. But it's also really crucial and increasingly coming to think about what are the more practical barriers that even before we get to this point about the right information, the right knowledge. If availability is not there, if the food is not being grown, the kind of healthy food that we need, if it's not being provided by business and government, then no amount of information or education is going to help. If it's not accessible, if it's not reaching the community that needs to, the right retailers and providers, if people don't have the means to prepare this food, then again, they're not going to be able to eat healthily. And then affordability, even if everything else is in place, if consumers can't afford healthy food, or even if the unhealthy food is relatively more affordable, that's still going to be a substantial barrier. So this means the policy bundle that we're working with includes labeling, it includes regulation of marketing, but also some of these points that we just heard about on fiscal policy, taxes and subsidies, public procurement, reformulation and fortification, increasingly nutrition-sensitive social protection, local territorial food systems. All of these are policies that the consumer movement is really advocating for. Some examples of how this works in practice, and these are really, as I say, there's a lot of examples from all around the world. So just taking a few, I think are especially interesting on some of these, some of the different ways of working. Advising government policy is often in many cases a close relationship between consumer advocates and the different government bodies that guide policy on healthy food. Sometimes it's kind of even constitutionally mandated. A lot of countries have, but there is a necessity to consult consumers on policy development, and so provide a lot of voice there. With a great example recently where our member in Rwanda, ADACOR, the Rwanda Consumer Rights Protection Organization, were appointed to chair the country's Fortification Alliance that led the development of guidelines to prepare the country's fortification policy passed a couple of years ago. Another way of working, building bridges between stakeholders. In this case, I think mentioned our member in Brazil, IDEC, Institute for Consumer Defense. They were co-founders with a number of other organizations of this Colansa community of practice on nutrition and health. I think especially interesting in this case is it's a Latin America and the Caribbean wide network. It's not just one country, which is where a lot of our members work, but really thinking about how can we share research and learning and ultimately campaigning across borders to learn from each other. Delivering original research and evidence, a really strong focus. Got a mention here of the Consumer Council of Zimbabwe, who monitor and publish prices for a basket of essential food products every month. Policy campaigns, El Poder del Consumidor in Mexico, a great example as well. Their Alliance for Healthy Food successfully drove policy action on front-of-pack labeling and sugar-sweetened beverage taxation. Demanding better business practices, often a more difficult one, but which in the UK recently, in response to rising food prices, issued a call to action for retailers to protect vulnerable consumers, and then went to these retailers to engage on how can they start shifting their business model to include these protections for the most vulnerable. And then another area that's really growing rapidly, and I think will tie a little bit to the next section of this session, is on grassroots alternatives. Our member in India, Mumbai Grahak Panchayats, run a collective buying model where they provide fresh local food to over 36,000 families in the region, providing a way to really change those incentives, that barriers of availability, accessibility, affordability, to help consumers access healthier food. And so as I start to conclude, I think there's worth thinking about what the future of consumer action is. There's a strong, obviously, track record of working in this space, but as I think was likely to be a theme throughout, this challenge of financing, of funding, and of capacity for independent advocacy for social action is one that is only growing as an issue. So I've got the first point here, obviously, on the radar for everybody, how to deliver this impact in a self-sustaining way. That's where we hope that Consumers International can come in and provide even more support to our members working on this. We're thinking a lot about what are the ways of building these connections across country, of providing the supports both from technical expertise, like in partnership with the World Health Organization and other UN agencies, other research organizations, providing those to the grassroots advocates who are best placed to really convince governments and to mobilize people, but thinking also about targeted supports for the most impactful actions. Mobilizing grassroots consumer voice, another really important element here. I think as we're seeing increasing interest in the role of whether it's citizens' assemblies or other form of participatory governance, ways of actually bringing consumer voice right into the process of policy development. I think especially with modern technology, it's more possible than ever to really start that engagement and to have not just consumer organizations representing consumer interests abstractly, but bringing through very directly what are the perspectives and the rights and the needs of consumers when it comes to healthy food. Building bridges for closer collaboration, another, again, as discussed by Katrina just now, but an important priority as well, thinking about consumer action not in isolation from other forms of social action, other forms of advocacy, but working with research partners, with kind of other social organizations representing particular groups within communities, I think a really important element. Thinking about new challenges, I've mentioned the health environment nexus here. Obviously, from a consumer perspective, it doesn't make much sense at all to think about just healthy diets, because when we're making choices, when we're engaging in the marketplace, nutrition, sustainability, food safety as well, are kind of all very interrelating and interacting. And I think there's a lot of thinking to be done on how do we bring through that perspective from not just policy development, where sometimes we see kind of action in silos, but working across those barriers, thinking also about local territorial markets, like I mentioned earlier, and social protection, boosting purchasing power, other ways of really transforming food environments from the beginning, not just waiting until that kind of final consumer choice stage. And then, yeah, related to this, scaling up this more direct marketplace action. So really interested to hear from the next stage of this session, some kind of work more related to that. So to conclude, consumer action has a really strong, often under-recognized potential to drive this transformation of food environments. But to maximize this impact, we need to focus a little bit less on individual choices and a bit more on how collective consumer action and advocacy can really transform the food environments in which we all operate. Thanks very much.
Thank you very much, Charlie. And just to remind our audience that you can ask questions through the Q&A the bottom of your screen. And now I hand over the microphone and the panel moderation to Alexandra Pine. Please.
Thank you. Good morning, evening, afternoon, depending on where everyone is. I'm Alex Payne. I'm a program officer with the Rockefeller Foundation in our Global Food Initiative, and I'm really pleased to be leading this panel on nutrition security and healthier food banking. You know, as we've heard many of the other people on this call mention, civil society action plays a pivotal role in program delivery and advocacy, and food banks and pantries and social canteens are all very important actors in ensuring local food and nutrition security. And I think often these institutions, as we'll hear today, go far beyond providing just meals to improving overall health and well-being through their innovative programs. So I'm excited to be here with these four experts. Maybe I'll quickly introduce them so they can talk about their work in addressing nutrition security in vulnerable groups. So we have Ana Catalina Suarez, who is the Senior Director of Strategy and Innovation with the Global Food Banking Network, Esteban Arriaga, who is the CEO of the European Food Bank Federation. We have Vandana Singh, the Director of Food Security, the Director of Food Security for India Food Banking Network, and Kelly Berry, who is a registered dietitian who leads work with Ottawa Food Bank in Canada. It's really great to be here with all of you, and I'm excited to jump in. But maybe just some really quick context on how Rockefeller touches on this work. So I work within our global food strategy, which in the recent past has included food crisis response and good food procurement work with public institutions. So basically looking to increase the use of public dollars to buy foods that are more nutritious, more regenerative, more equitable. And we've been specifically interested in how social safety net programs like food assistance, food as medicine, and school meals can also be used to meet climate goals and to improve farmer livelihoods. So maybe two really quick examples that relate to food assistance. In the US, we've been supporting implementation and technical assistance networks around the United States Department of Agriculture's $900 billion local food procurement assistance partnerships, which basically provides states with funds to purchase healthy foods from regional producers and distribute them into food banks and other food aid institutions. And then internationally, I'm happy to see them represented here. We've been supporting the Global Food Banking Network in 6 countries to both pilot and expand agricultural recovery programs that support more local organizations to improve supply chain coordination and capacity. And I'll start our panel now, and maybe I'll begin with you, Esteban. So The Federation represents 30 countries and operates through, I think, over 40,000 organizations on the ground. So what role does nutrition security play in that work with you? Esteban, we can't hear you.
You hear me now?
Yes.
All right. Obviously, the headphones don't work when you need them. But I'm glad you can hear me now. So, in general, it's very important to define how food banks work, at least in Europe. We do work through 40,000 organizations, so that means we provide food. So we recover food that usually would end up in a dump landfill somewhere in Europe. However, it's food that is perfectly fine, perfectly safe to consume, and we provide it to organizations working in the social realm. Could be homelessness, could be drug addiction, could be many of the ailments that we have now confronting as a society. And that has been the traditional form of food banking. And I mean, we're talking about 45 years of food banking. This has slowly started to change. We see more and more food banks starting to directly target beneficiaries where they see them, mostly identifying gaps or identifying a demand. And that puts us more and more in a place where we're dealing directly with nutrition. There is nothing new. Looking at the two presentations, we face the same challenges. We have faced a challenge about quantity, not only quality of those products. We as food banks receive that food, which is a reflection of our own supply chain and food system. We are not a participant, we are not producers. And in that sense, we try to do that. Increasingly, what we've seen is that the recovery continues to shrink somewhere, and more food banks have to resort to purchase food. Purchasing food is not new, but the percentage of that food increases. And that is partly because there's a huge increase of demand, especially since COVID all the way to the present, but also because we try to diversify the products that we give to people in need. For example, out of 850,000 tons that we distributed in 2023, 30% were fruit and veggies. This is an incredible amount, and a lot of big portion of that 30% is purchased. Increasingly, also, we need to work more with agriculture, which is not, and this is the definition of what is waste or what is not, but it's also very intensive. And we see that those kind of elements having to change a bit the platform and how food banks approach this challenge, which is a collective challenge. And we're just one of many. I won't use more time because I know there's other food bankers in the panel, but I'm happy to expand if needed.
No, that's wonderful. Thank you, Esteban. Ana Carolina, I know a little bit about the work with Global Food Banking Network, but they've built a giant network that reaches millions through food banks in over 50 countries. And so maybe following on Esteban, it would be great if you could tell us about your work on improving access to healthier foods for vulnerable groups in these countries.
Alexandra, hi, good morning, good afternoon, good night in some cases. Thank you everyone for being here. And I would like to start saying thank you to the World Health Organization for inviting us to talk about the amazing work that the food banks are doing across the world. I'm super happy to having Kelly from Ottawa here, Vandana from India, of course, and of course, Esteban, all of them, our friends. And Alexandra, thank you to the Rockefeller Foundation. I need to start by that because Rockefeller is one of the organizations that has been believing in the important role that the food banks are playing in the food systems, and not just in the food system, speaking about the nutritional impact, but the climate impact at the same time. And I would like to just following the numbers that Alexandra was mentioning, GFN is a global organization that is working over 50 countries. Last year, in 2023, we served more than 45 million people, including 16 million children and 21 million women and girls. And this is becoming more and more important as Esteban was mentioning. The food distributed by the food banks that are in the GFN network included 60% of nutrients-dense items. That means fruit, vegetables, grains, proteins, ensuring that vulnerable populations have access to healthier food options. And the main point here is food banks are making available food that in other cases was not going to be consumed. The network's food recovery effort not only addresses hunger, but also had a significant environmental impact by preventing food waste. And I would like to connect, Alexandra, the interconnection. There is an interconnection between climate and health. And it's very important for us to talk about that, because at the same time that we are making available food that in other ways was going to be wasted, people is reducing the diseases that are attached to malnutrition and different nutritional diseases, if I can say it like that. Then what the GFN organization is doing across the globe is ensuring that we are making available food, healthier food for vulnerable populations. And I love a number based on some of the researchers from FAO, that if we just prevented 25% of the total food that is lost or wasted, we can feed with high nutritional food 800 million people across the world. That means the total people that is facing hunger. Then what GFN is doing is providing, we don't have the knowledge. Kelly, Vandana, and Esteban, they are the one that has the knowledge on the field. They are the one that know what is happening. Then what we do is provide support. I usually use that we are doing cross-pollination. That means we are bees that are learning from what everyone is doing and creating a knowledge sharing platform, ensuring that everyone is accessing to the development, innovations, and work that the food banks are doing across the world. I will say that we are working in more, I say 50 countries, but we are more than 2,000 food banks across the world working, reducing food loss and waste, but at the same time feeding people, vulnerable population, and making available more nutritional food for people in need.
Thank you so much, Anna. I think maybe now is a good time to go down to the country level. So Vandana, I know in India, the government provides a large portion of food for the population, about 2/3, mostly with basic food staples, and food banks really work to complement that and to supplement that. Maybe you could tell us a little bit more about your role and your organization's role in that system.
Sure. Thank you, Alexandra. Just to tell a little bit about the food security program of the government. So it is called the Public Distribution System, and whereby in 2013, for the first time, food security was not regarded only as a welfare scheme, but it has been given, as legal entitlement for the citizens of India. That was a very big development. And the government since then has been trying its best to make the whole system more efficient and to reduce any leakages or any inclusion or exclusion errors, and try and reach out to all those who are in need. However, what happens is that the products which are given through the public distribution system are mainly rice and wheat, and it being more the cereal base, we have found that it is lacking in proteins, which is a very big deficiency among people across the country. And so what as food banks we are trying to do is add these products and make it available to the most vulnerable population. So whether it is pulses and also other products which are required, but which are also very expensive, for example, edible oils or spices, and many other, protein-based products. So that is what the food banks have succeeded in adding to the diets of the people they are reaching out to. And secondly, also, while the government is trying to reach out to 67% of the population, 75% in rural areas and 50% of urban areas, but still there are some exclusion errors, or there are people most vulnerable who are not able to access this service of the government. These could be like, you know, very old age people, sick and vulnerable people, orphans, homeless people. So the food banks, India Food Banking Network and the associated food banks are reaching out to these people who are unable to access the services of the government. Civil society in general has pitched in to try and make these people be able to access the government facility, the government services and programs. However, where it's not possible, where they have not succeeded, we at food banks come in and provide direct food assistance to the most vulnerable, both in terms of cereals and also protein-based products. So I will stop there and happy to take the conversation further.
Yeah, maybe I'll follow with Kelly. Maybe you can tell us a bit more about the more holistic approach of Ottawa Food Bank to nutrition and security, and maybe share a little bit about the nature of the way you partner with public health.
For sure. Yeah, thanks so much for having me. And I'm really pleased to be able to share a bit of the great work that Ottawa Food Bank's doing. So just to give everyone a little bit of context, we are a food distribution warehouse in Ottawa. So individuals don't come directly to us. We actually distribute food to about 100 food programs across the city. And we're about 98% funded by our community. So very little government funding comes to the food bank. And so the journey really to kind of a more holistic approach to nutrition has been a gradual one. It started in about 2017. And really the organization identified that they were a major contributor to nutrition for marginalized populations in the city. And recognizing that was they were accountable because they were such a significant contributor. So really made a strategic shift at that time and committed to addressing nutrition in food distribution. So really shifted from that hunger-based response to more of a food security and nutrition-based approach. And so once that was in the mandate, they knew they were accountable for that and how wanted to ensure that really they were contributing to the health and wellness of the population. And so began that work intentionally and partnered with Ottawa Public Health really to guide investment. So how should we approach this? How should we, where should we start? And it led to something called a Heart Smart or Health Smart rather project. And that's where really they decided to shift some of the investments from some of the non-perishables like canned pasta and the boxed mac and cheese and shift that to protein sources. And that was fresh meat and milk were the first two items that were kind of focused on. And that addition of fresh items was really well received by our network of agencies, and that investment has really grown over the years. So between 2017 and now about 50% of what we purchase is actually fresh, and that includes both regular and halal beef. It includes fish, halal chicken, eggs, milk, fresh fruits and vegetables, and fresh bread. And at the time, the other area of focus that was suggested by Ottawa Public Health was to focus on lower sodium, lower sugar, and higher fiber options in the non-perishable items that we purchase. And so the decision was to shift from purchasing white rice to a brown rice, a whole grain rice. And I'm sharing this because it's a learning experience. And actually what Katerina mentioned earlier about choices sometimes are also important. And we actually found that there was limited interest actually in the brown rice, and the agency stopped ordering brown rice from us. And, a couple of reasons for that, the preference for people who were accessing the food banks. And thinking about also accessibility, brown rice takes a lot longer to cook. And when you're on a really limited budget and you're really monitoring your use of energy, something that takes a lot longer to cook is something that's not as desirable. And so that was a learning experience. And we went back to purchasing the white rice, which is a very sought after item at our food bank. And but it's one of the things And I share it because it's one of the things that kind of led to, again, this holistic approach, and it led to the including a registered dietitian on the OFB, on the food bank staff. Really recognizing, we have a role in terms of what we distribute, but there's also that role in terms of somebody out there on the ground kind of championing, sharing expertise and experience to champion the change that we want to see in the community, recognizing that folks need maybe some additional resources, information, and support in how in making those nutritious choices. And so we've created something called Healthy Marketplace, and that is workshops that we conduct with the network, and talk about label reading nutritious foods, provide resources, and really try and focus on where folks in each individual agency are at and what they need to support some of those nutritious choices. So.
Thanks, Kelly. Really exciting to hear about kind of the on-the-ground adaptability to each community's specific needs. And maybe that gives me a good opportunity to go back to Esteban, since we're talking about how different the realities on the ground are in different countries. Esteban, maybe you could provide us with a few specific examples from your efforts to provide healthier food options that are more country specific.
Thank you very much. Yeah, so I gave an example of across the board what many of the food banks are trying to do and having a higher priority in it. We've seen, as you can imagine, 30 countries in Europe, we have so many diversity, cultural, historic, linguistic. So to frame it across a continent that is so diverse is very difficult. But we've seen from our members, for example, recently I was in Greece, and I was impressed that they were developing actually a diet and a meal and a package that is already tailored to the demographic they were reaching. And this is a level of support that is quite unique, even amongst food banks, in which they were doing it almost house-to-house deliveries. Why? Because they were targeting a demographic that was in high need, and these old elderly people that have restricted access and mobility. And they have partnered with nutritionists on the ground who also volunteer to deliver this kind of support. This is one example of how they're trying, and this is actually in very urban areas. So you can imagine that the level of attention, knowledge of the community to be able not only to identify, but also target and reach these people is quite unique. And this is, I think, what food banks, and I think many of the panelists have mentioned, is that it has to be a grassroots. It has to be brought from it. We have 95,000 volunteers and co-workers across our membership. And these are people in the community, and that places us uniquely how we can deliver. But these are very complex programs to do at scale. So we also have to be realistic about what we can accomplish at scale. In France, the government has made actually a guidance and legislation regarding what could be a balanced diet, in which the food banks have been adhering and using it for their own operations. So that's an example that is actually more wider, where the government in France is far more involved in many of these kind of civil society actions, and the food banks are responding to that, obviously. So these are two very opposite examples. One is very granular to a household level, and the other more at the national level.
Thanks, Esteban. As you may know, even in our own work, especially through kind of the height of the food crisis, we put out a paper and a lot of conversation around the importance of localization, and really thinking about how national and international groups can really let the work be locally led, mostly to drive more meaningful impact. So maybe that's a good time to switch to Ana Carolina, because your work also spans many different countries, and it's interesting to understand maybe how you go about measuring your impact, and how does it inform your strategy to improve the nutritional quality of the food you're distributing through this network, or that your network members are distributing.
Alexandra, thank you. I think this is very important and becoming more important in the prevention of the greenwashing, social washing, that is a worry that everyone is having. Are we really providing a huge impact? And this is an important work that we are doing in GFN with our members and the food bank that we are working with. Data and impact measurement is essential for improving the nutritional quality of food distributed through food banks and for maximizing the social and environmental benefits of food recovery efforts. It's for that metrics such as the percentage of food distributed with higher nutritional value. Let me just repeat that 60% of the total food distributed has higher nutritional value. Again, fruits and vegetables, grain, pulses, legumes, dairy, animal protein, and water. The demographic breakdown of beneficiaries, for example, 16 million children and 21 million women and girls served last year by the food banks, provide valuable insights into the reach and effectiveness of food banks operations. And I think having all these metrics allow us to demonstrate the huge impact that the food banks are providing on the field. Additionally, methodologies like the food recovery to avoid methane emissions, the FRAME methodology that was developed by GFN in collaboration with Global Methane Hub and the Carbon Trust, play a critical role by quantifying avoided greenhouse gas emissions, CO2, specifically methane, but highlighting the co-benefits of food recovery. These co-benefits align with multiple sustainability and sustainable development goals as SDG 2, Zero Hunger, SDG 12.3, reduce 50% the food loss and waste, but SDG 13, climate action. Then by integrating all these data, providing data-driving insights, food banks can not only refine their own strategies to have more healthy food, nutrient-dense food, but also demonstrating their contribution to broader societal and environmental goals. Just to finish, these metrics and methodologies are valuable for engaging stakeholders, including scientific experts, policymakers, and private sector, to scale up of the food recovery efforts and secure additional funding and support. And I would like to say thank you again to Rockefeller, because he's seen that this data is providing and allowing us to measure the nutritional impact that the food banks are providing on the field. That is not just for the people in need, it's for the climate and adaptation policies that the different countries are putting together.
Yeah, and it's great to hear you also bring in, we are in this moment of climate crisis, really thinking around how we can provide sort of multiple co-benefits all at the same time. It's something we have been thinking about deeply, and that and I believe your team also has. So maybe in talking about driving impact, maybe you can speak a bit to how you realized that offering this fresh produce, fruits, vegetables really provided additional benefits and multiple different co-benefits, and how your organization has gone about providing them. You are muted.
Sorry. So we've been aware of the fact that about 20 to 40% of fresh produce, different varieties of fresh produce, go waste. And not only is that not available for consumption, but it also, goes to landfills where it emits greenhouse gases and adversely impacts the environment. So the most preferred action would obviously be to develop infrastructure of logistics, transport, storage, so that we are able to, make as much of the fresh produce available for consumption and not let it go waste. Governments and private sector are putting in that kind of investment in food processing industries and transportation and logistic to achieve that objective. However, it was during the pandemic that we realized, because the pandemic, highlighted the importance of nutrition as a first line of defense against disease. And we knew that the poor and the vulnerable, whose nutrition status was the lowest, was disproportionately impacted by that. And it was then that we as a network decided that we need to concentrate more on recovering recovering the fresh produce from markets, wholesale markets, retails, farmers, farmer producer organizations, and make it available to the most vulnerable people. So we started with a pilot in Delhi in a market, wholesale market here, which is the largest fresh produce market of Asia. And it was a very successful pilot where we were able to raise a whole lot of fresh produce, which comes to these wholesale markets. And a lot of it was wasted at the end of the day before the markets closed. And a lot of it came to us for donation. We also saw that there was a possibility of purchasing produce from these markets at very, very low rates because that was the wholesale rate. And then there was also distress sale at the end of the day when they knew that they cannot sell it any further into the market. And so both donation and purchase possibilities we saw in the pilot, in the study. And since then, we have taken up this project of recovery of fresh produce in 5 metro cities of India, and which is going to be further extended to another 4 cities. So in these 9 cities, we are going to be able to recover fresh produce from these different sources, wholesale markets, retail, farmers, and farmer producer organizations, and make it available to the vulnerable in 2 ways. One is through direct distribution to families and communities. And secondly, they will go into the feeding programs also, which are run by the food banks, either for children in schools for underprivileged children, or also for in other not-for-profit organizations who are feeding old age people, charitable hospitals, homeless shelters, etc. Thank you.
Thank you. And maybe I'll shift back to Kelly. It kind of leads in well because you also talked about going beyond anti-hunger work, and it would be great to hear more about what the food bank does to ensure access to these healthier foods for its beneficiaries, and how you're thinking in ensuring that the food bank's purchasing is healthy, and the challenges to that.
Yeah, for sure. So the first thing really, and I had mentioned it, is the prioritization of the fresh, healthy food. So we really are committed to this. And as I mentioned, about 50% of our budget goes towards fresh. And we've been really fortunate to be able to fundraise year over year additional amounts to be able to maintain and increase those amounts. So that's one piece. The second piece is we actually created a food procurement framework, and that's something that I'm actually working on at the moment. And it's really to guide both our purchasing as well as what we're looking for donations. So it outlines the focus on fresh, minimally processed foods and canned or packaged foods that are lower in sodium, lower in saturated fat, lower in sugar, and higher in fiber. And so there's specific guidelines in the framework that show the amount of the nutrients that we're aiming for. And it really gives us, our procurement team. So I work closely with our procurement manager, and we look to try and find foods that are packaged foods that are lower in those nutrients or higher in some of the nutrients that we want more of, and at a price point that is still reasonable, right? We are always balancing, what is affordable and what is also nutritious. And it also gives our fundraising team something to kind of focus on when, an organization comes and said, we want to do a food drive for you, or what types of foods are you looking for your children's food programs, that type of thing. And so the framework really gives us something solid to fall back on and to say this is kind of our guide. It's not rigid. We always have to balance, donors sometimes want to give things that aren't as nutritious. And so we have to always kind of come together and look with our, our fundraising team, our operations team, myself, and we look at, whether we want to accept certain donations or not, but we use this framework as something to fall back on to guide us towards those healthier options. The other thing that I'll mention too is a granting program that we have created for our network of agencies. So it's called a Global Marketplace Grant. And really the idea of that is knowing that there are different communities within our city where different foods are really sought after. So culturally appropriate foods. The Global Marketplace Grant gives our agencies dollars that they can purchase specific foods that are sought after by their own by their community. And so each of those communities is a bit unique, and that's where the granting really allows them to purchase foods that folks want. And those are always those nutritious foods that we talked about. So, you know, legumes and different culturally appropriate or culturally relevant fruits and vegetables, country meats for our Inuit serving agency in Ottawa, herbs and spices, oils, things like that, that really allow folks to have access to those culturally appropriate foods. Because we know nutrition is so important, but also food is more than that for people, and being able to offer that those foods that are a taste of home and part of their culture is a really important piece as well. So I think those are sort of the main kind of things that come to mind in terms of how we try and really keep the focus on health and nutrition.
Yeah, very exciting to hear. Again, just so much focus on culturally appropriate foods and really thinking about how to also incorporate local livelihoods into this kind of matrix. I think instead of posing a final question to each of you individually, what I'd actually like to do is to offer each of you space to sort of reflect on what the biggest challenges you see for healthier food banking in these coming years are. I know in the US context specific, we are really thinking about what a shift in administration will mean for a lot of the programming we have. Or if you'd prefer maybe to look to reflect on this on your side, maybe what are the opportunities that any or all of you see for really combining nutrition security with this food loss and reduction with this more regional, urban, rural, agricultural recovery model. And maybe just to keep some sense of order, Esteban, I'll go to you first, and then I have bought everybody else a little more time to consider questions that they had not prepared for.
Thank you very much. Challenges. There are several. They are not unique to food banks. I mean, we can talk about, for example, the climate change and the impact it has on supply chains, for example. That touches on agriculture and uncertainty in the regular supply. That is something that we also experience. Again, we are maybe not at the end of the supply, but in parallel to the different stages from production all the way to retail, where we are the most prominent. So these are elements that we see. But we also see the other side, which is the effects. We have the situation in Valencia recently, for example, where, for example, food banks were also requested to support to the drive, and we were lucky to have a lot of outpouring of solidarity to do that. This is also something that we see a lot in the food banks, seeing that they are stepping into the realm of the response to climate effects in several parts of Europe, partly because we have such a community, a robust community center approach that we actually have that kind of capacity and a possibility, but it's not something in which we are yet comfortable with. So it is how we start to do other things more based on the developments in the context rather than actually something that we plan for. And this is something that we need to discuss. The increased discussions on nutrition alongside quantity are things we need to do, because there has been an increase in demand. Inflation of those products becomes an issue for members, but also for the purchase to complete those meals. It also impacts the budgets of food banks. So how do we keep up with demand? I think that's always an aim, never really a reality, unfortunately, and sadly, it is like that. So those are challenges that we see, and we will continue to see in the coming futures. I think we put more and more pressure on ourselves to always do better, to comply with the new awareness as a society, nutrition being one. I think it's something that already is clear, but it's maybe not general knowledge. And I think my point of reflection is that there's still a lot that we can do on the raising awareness and knowledge. I think, Debbie, you asked if we're doing with the trainees culinary skill building. We do. We do that for two reasons. One is to develop those skills for people that can actually not only receive, but can manipulate those perks to consume them responsibly, but also as a way to engage with the community. There's also the element of mental health and community coming together that is also very important for food banks. But we have to say the knowledge and the sharing, it is difficult also how you, for me, it's more important that we create the knowledge and provide the information for people to exercise their own agency in the decisions that they make at the household level, at the unit level. I think it's very hard to generalize and provide policies and discussions and train, but it's about time, it's about resources, it's how much we have now, for example, an increase in single-headed households that have children, that have full-time jobs. I don't know about you guys, but I struggle though to find the time to do my meal prep and have everything ready, and I don't have children yet. So it's about how we take a people-centered approach rather than maybe understanding the challenges that are faced by the people that are in need. We have, I mentioned the elderly people. Sometimes there's mobility problems. There could be energetic problems, even heating the houses. And I know Europe is a very rich continent, and it is, but we see more and more of these people coming to us for help. So I think these are the elements of how we make these things at scale. We have to be very specific of who we are talking to. A small example, I was recently in a food drive and we were giving food to people, and I was stuck with doing butternuts. Nobody wants butternuts. So I was end up with explaining to people the recipes for butternut, which I have a couple good recipes, and it changed. Then people started to say, I'll experiment with butternut. And these were at the university level. I was like, impressive. So now to teach who is, to assume what people know, and then the resources that they have, time being one of the most precious resources that we can do. It's not only money. It's an important thing to take into consideration. I think more and more food banks are doing that and spending more of this on the skill sharing. Finally, is the raising awareness and the agency. And I'll say something very controversial, but that I dabbled in my public health times, is that in the 1980s, we knew there was a correlation between smoking and cancer. Yet the prevalence of smoking amongst medical practitioners was high above average. And we need to understand that changing attitudes or changing behavior takes time and takes repetition, and it takes a lot of these things. So we have to be patient. We need to be considerate to people, and we need to provide the tools for people to make those decisions. Thank you.
Absolutely. You and I can swatch some butternut squash recipes. It's quite common in North America. And important to hear you also attribute some of the challenges to supply chain issues. I think for me, I used to be an urban planner, and really thinking about the ag in the middle needs, the need for stronger regional food system resilience based in stronger local supply chains, and investment in those, and investment in those in a way that supports local communities is important. So exciting to hear that. And Anna, I'll go to you to talk about either challenges or opportunities.
Alexandra, thank you. And let me just have it in mind that we are going to have Kelly and Vandana speaking from the field, what is happening, the challenges that they are facing. And I would like to give that space for them as following what Esteban was saying. I don't want to repeat, just I want everyone having some numbers and issues about why we are at GFN increasing the awareness about the interconnection between climate and food security, because we believe that is important. And I just want to say, if we have someone in the audience from Brazil, we are really expecting amazing results from the COP30 that is going to happen and is going to impact with the declaration of the Global Alliance for Food Security that the Lula da Silva, the president, has launched at G20. This is going to be huge for everyone, and we are expecting a lot of participation from different organizations around that. Let me just, climate change disproportionately affects vulnerable populations, and this is huge and important. While low-income countries contribute only 10% of global emissions, I'm talking in general about Global South, they suffer 90% of the economic losses related to climate disasters, according with the World Bank. But according with the World Health Organization's report that between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year from malnutrition, malaria, diarrhea, and heat stress, primarily affecting those in low and medium income countries with limited healthcare infrastructure. But these two that I think I'm going to finish with something about gender, that is what we are seeing is the gender gap is again growing, and having a focus on women is becoming again more important than ever. According to UNICEF, children in the poorest communities are up to 14 times more likely to be killed by climate and environmental disasters compared to children in higher income areas. That means that, and have in mind that with nearly half of the children globally, 1 billion, living in areas at extreme risk, women and girls are 14 times more likely to die in climate disasters than men. And 80% of the people displaced by climate change are women and children. This is huge, and it's important to have in mind this data because it's what we are doing with this, how we are supporting. Preventing food loss and waste not only reduce 80 to 10% of the total global greenhouse gas emissions caused by food waste, but also ensures that more food, particularly nutrient-rich options are fruit and vegetables, is available for food redistribution. And I'm going to finish with something. Food banks supported by GFN currently rescue only 1% of the total global food loss and waste. That means that we have huge opportunities to increase our efforts. As Esteban was saying, we are talking about policy. We really welcome the last meeting of the European Commission where the FIBA was participating actively to ensure that we were including donation and food redistribution as one of the key elements to reduce food loss and waste. Then we believe that this is one of the key elements. There are many opportunities. We are just recovering 1%. That means the amount of work that we can do together to reduce the food loss and waste, but at the same time to provide nutritional food for vulnerable populations is on the door. We just need to take the decision together to change the situation of them.
Yeah, thank you. It's such an important point to make, that we are learning how to do it, but we have very far to go, which both seems like a challenge and an opportunity. So, Vandana, maybe you can speak more on the ground to the challenges or opportunities that you are seeing.
So one of the challenges which we face amongst many is of child malnutrition. And it's very important to address child malnutrition because it impacts the children's health, education, development, their future earning capacity, everything. So what we have been doing is we have developed, and like Esteban earlier also said, it's about providing knowledge, it's behavior change, it's providing access to food, and we need to bring all that together. So one of the programs which we've developed, and it is very popular in schools and among children, is the development of school kitchen gardens, where we are teaching the children to grow their own fruits and vegetables in small spaces, whatever is available to the school, in and around the school. And the children are not only getting skills on growing their food, right from preparing the soil, sowing the seeds, watering, harvesting, everything, but they are also then able to use this food either in the midday meal scheme in the school premises, or they can take it back home to be eaten at home. So not only are the children learning to grow their own vegetables, but they are also having access to those vegetables which they grow. And nutrition education is also a part of this program, where the children are taught about the nutrition of these the nutrition aspects of these vegetables. You know, a lot of children find they are very picky about what vegetables to eat and green vegetables. So, but when they grow it themselves, when they learn about the nutrition facts about these vegetables, they become, you know, more amenable to consume these fresh fruits and vegetables. So the school kitchen garden program has been one very good opportunity where we are able to target the future generation, provide them education, provide them skills, and also provide them access to the nutritious fruits and vegetables.
It is an amazing program. And I spent quite some time doing urban gardens, so I know how important it can be for shaping the future of the way children think about their diets, but also in changing access. Kelly, I will turn it to you for more sort of on the ground perspective from Canada.
Yeah, so biggest challenges when you say, I think, you know, what first comes to mind for sure is just our increasing numbers. We've seen a 94% increase in visits to our network of agencies, to our programs since COVID. And so we're just seeing an unprecedented need in our community, and the cost of living, the cost of housing, all of those pieces that are impacting folks is really having a lot of people turn to food banks. And so that growing need, I think, is probably one of our biggest challenges. One of the things that I did want to speak to, just because I think it's a really important addition to some of the information about the work that Ottawa Food Bank is doing, is we also actually have a farm where we grow our own produce. And so it started in 2010, I think, very small. And in 2012, a local family offered the use of 11 acres of land without charging any kind of a rent or a lease agreement. And so we've been there since then, and have about 7.5 acres now that are producing food. And so during our growing season, that supports our distribution of fresh fruits and vegetables, and it also allows us, our farmers are partnering with other local farmers to help us to access locally grown food and to help us distribute more of that good local fresh produce. So it touches on some of the things that the other speakers have touched on, and I think it's an important piece that I didn't want to miss to highlight. And just to share that we actually grew 152,998 pounds of produce at the farm just this past season. So it's been a really great initiative, and again, lots of really good support locally, and really well supported by volunteers as well. We've had I think 1,100 volunteers over the season, and it's a great opportunity for individuals to volunteer, and also we see lots of corporations come out and do team building and different activities at the farm to help support the planting, the weeding, and the harvesting, and the getting the produce ready for distribution. So that's not quite one of the challenges, but I think others have spoken a lot to the challenges that would resonate with us as well, and that would impact us at that frontline level. And again, our biggest challenge is just this ever increasing need that we are seeing, and it's hard to keep pace with, and hard for our network of agencies to keep pace with, when none of the work that we're doing is funded. The Ottawa Food Bank isn't funded by government. Some of our agencies get small amounts of city funding for some of the programming that they run, but much of this is grassroots. It's volunteer led. There isn't, paid staffing for a lot of the positions, and so the work is really amazing that people are doing and are dedicated to. But we see the need that there needs to be a bit more of a perhaps government, intervention or support of some of these initiatives as it grows so significantly. So thanks for the question.
No, thank you for adding that, and also to speaking maybe to an important opportunity for cohesion to be formed, and for other sorts of benefits to local communities and in growing their power and their connectedness. I will pass it back to Luz to close us out. But thank you all so much for a very engaging and important conversation.
Thanks, Alexandra. Excellent moderation.
Thank you so much, Alexandra, and thank you for the moderation. I concur, it was an excellent moderation, so it's leaving the bar high for me. So We have a couple of questions from the audience. We don't have much time, but I wanted to come back to one comment that talks about the type of donations that food banks receive. There is this perception that donations are mostly foods that are high in sugar, high in fats, high in salt. And of course, one of your interests is keeping the agency of the populations that you serve. But are there any efforts to guide the donations? We are seeing that more and more, for example, countries are adopting front of the package labeling. We have worked with a couple of organizations in guiding some procurement based on the front of the package labeling. In Europe could be Nutri-Score A and B, for example. In some other areas, maybe other type of, with some type of warning labels in South America or not. So do you have any suggestions for the donations? Of course, people is free to donate whatever they want and everything is welcome. But are there any efforts that you are making in terms of guiding and making sure that donations are healthier?
I can.
Yeah, whoever wants to take it.
Oh, or Kelly, you want to come in first?
That's okay. Go ahead. I can jump in after you.
I think for us, we are, as we mentioned, we take a lot of effort in providing that kind of balanced diet. And I think, unbeknown to most people, it is also very hard to say no.
Mm-hmm.
And this is what we're doing, I think, to a certain extent, saying no, thank you very much, but we need the diversity that creates a balanced diet. So we have, I think, increasingly we see that often, which was not the case in the past, and I think that comes with the increased awareness. Again, food banks are not a government entity that exists; it's people. It's formed by people from the grassroots, and I think as the subjects become far more prominent in the media, etc., we are becoming better at making those decisions. And it's very hard sometimes to say no, thank you, or we prefer this kind of support. And I think that is an important element that maybe gets taken for granted, but it's a very big development for us, because we used to say, well, if it's available, why not? Now we are increasingly no. And we have actually an increased consciousness about the do no harm. And that's also an element that I think it's becoming far more prevalent. While we don't have any policy that guides all of these efforts, and I don't think we'll ever have a food banks because we also have a very diverse group, we do have, I think, a greater unison in our conscience regarding these elements.
Thank you so much. Kelly, do you want to comment?
Sure. Just to add, really echo what you said, Esteban. Very similar. The framework that we're creating to guide not only our procurement but also to guide our donations. Our team that fundraises needs that support to be able to say, no, this is actually what we're looking for. As an organization, we are committed to having a positive impact on the health of our community, and these are the types of food that we want, and this is why. These are more vulnerable folks. They have limited choice or less choice. These more nutritious items are really important, and so so I think it's that commitment piece, and also having the framework helps. It's not a rigid policy, but it's a guide, and it helps to shift us in the right direction, to ask for the types of donations that we want. And we do sometimes say no, and it is hard to say no sometimes. And we come together as a team. It's not just, me as the registered dietitian making that decision. It's sort of a team decision. And sometimes we may accept something that's not as great, but we get something else really good with that. And so sometimes it's a balance for sure. But that is a bit of a challenge. Yeah.
Thank you so much. You talk about malnutrition in terms of, I guess, underweight or stunting, but what about the demographics in terms of changing or receiving more beneficiaries with diabetes, hypertension? We certainly see that a lot of the migration that is happening in this moment, people migrate or are displaced with their own non-communicable diseases, diet-related non-communicable diseases. And we have seen that there is a more vulnerability in lower income in terms of seeking access, of course, the right type of foods that are companions to the treatment. So can you talk a little bit about if you have any numbers on the type of beneficiaries that you're receiving related with non-communicable diseases? If that is information that is made available to you, of course, because there are also sensitive issues there.
Well, Ana, por favor.
Thank you, Esteban. No, just to say that we are not collecting data related to the diseases that the people that we are serving are having. This is a very private information that should
sensitive,
be
yeah.
Exactly. Then we are ensuring that we are accessing, asking for data that can be used to take decisions that are in our hands. And I think that is very important. The balance between the amount of data that we are asking for and what we can do with that data is very important. But one of the things, and Kelly was mentioning before, is the relationship that we are doing with the relation that we are having with other organizations, and how we are presenting these people that we are serving to other organizations, including governments, NGOs, and companies that are already serving and providing health services or other services that allow us to serve the organizations the people that we are serving in other way. This is something that we usually do.
Thank you.
Can I add?
I think Esteban, you wanted to comment as well. Vandana? Okay.
Yeah. So
Go, Vandana, please.
Okay. So I wanted to come in during the last question also. So what I was saying is that we don't say no to any food as yet, because the number of people who need to be served is so high. So the decision we have taken is that we will spread that food among a larger number of people, what comes to us, so that everyone gets, very limited quantities of food which are high in salt or sugar or fats. And I want to share that in India, we have this provision whereby companies above a certain turnover need to compulsorily spend 2% of their profits on CSR activities. And we approach all these companies to, for grants for purchase of food. And here we make all the decision about what should be the quality of food that we purchase. And through this CSR funds and grants which come to us from the different companies from India, we are able to provide nutritious food to people whom we serve.
Thank you so much. Thank you for that addition. Esteban, do you want to comment on the type of the demographics of the population that you are serving in terms of non-communicable diseases?
No, I think it's the same as Catalina already mentioned. That will create a big problem with the privacy laws in place. And as I mentioned, we work through 40,000 organizations. So some of these organizations will have this information because some of these organizations are dealing with healthcare specific outcomes that they need that information for their own operations. We do not ask that information. I think at this stage, and I think will remain likely, it's more a preventative, prophylactic through a better quality of services and options of products we provide to people, rather than something that really intrinsically goes to people already experiencing several illnesses. As I mentioned, we have the elderly will have mobility challenges, and those we try to target specifically. But yeah, I think that would be very difficult for us to not only ask that information, but I think increasingly what we ask, once we ask information, what do we do with that information? And that's also responsibility. We're talking about millions of people information. So we are increasingly trying to develop those kind of methodologies to say, okay, what we want to, for example, gender disaggregated data. I think we all agree that's a very important element, that at accumulative does not represent a big privacy as long as it's managed correctly, but that at least allows us to who is accessing those services and why, and how we can start to pivot and really make sure that we are trying to access those that are the most vulnerable, who are usually the ones that we don't see. that is part of being marginalized and vulnerable.
Thank you so much for that. And Charlie, you have a question that you already answered on the chat, but I will go back to you on food consumer action. What's your opinion on impact of value addition to food in the scarce seasons or periods or droughts?
Yeah, of course. Thanks for that. I think as we've heard from a lot of the previous speakers, the previous panel, obviously fresh, minimally processed food always is an aspiration. We recognize there's so many contexts all around the world, especially in times of emergency, but even outside of that, where we have to be practical. Value addition, whether that's through action to fortify food with key nutrients or to help reduce loss and waste, obviously can be really helpful for meeting nutritional needs for especially those vulnerable populations. But I highlighted as well a couple of kind of risks to be aware of concerns there in regard to kind of market concentration. Certainly, we see already in times of crisis issues of rising prices, especially for the most nutritious foods, and adding stages to the value chain can sometimes lead to really excessive pricing at that stage. So one to be very wary of, and similarly trade-offs with nutrition, thinking about dietary diversity, not creating an over-reliance on these kind of more processed foods or kind of often key staples that are the target for value addition processes. So a few considerations there, making sure that the goal is, still about nutrition, about meeting people's needs, rather than just an economic goal, which obviously is understandable why countries are often focusing on the economic value of adding that processing stage in country, but making sure that it is aligned with nutritional needs and not run by an entirely separate ministry away from concerns about health and about access to food. So a bit of a mixed picture there. Clearly is necessary and valuable, but just urging consideration on some of those points.
Thank you so much, Charlie. And there is a question related to food safety. We haven't talked about food safety, but I know that many of you have commitments even on your website on how to ensure that there is food safety. And maybe you can talk a little bit more, because as you bring more fresh food, the food safety needs are, the food safety management system needs to change a little bit. So you have already alluded to it, Vandana, but maybe having a more broader statement on efforts of food safety as well. Maybe I can go, Vandana, just to reiterate what you have said before, but maybe after that to anyone else who wants to take the floor. Vandana, do you want to go first? You are on mute.
Actually, could you just repeat the question? I didn't get it.
The question is what efforts you are doing in terms of food safety to ensure food safety, and also to make sure that as you bring more fresher food, the food is, you change your food safety management systems in terms of refrigeration, in terms of preservation, or any other practices.
Yes. So with packaged food, the food safety issue was much less. However, with the fresh produce, the food safety issue becomes much bigger. And infrastructure in India, as it is, as I pointed out in the beginning, that in general, cold storage and transportation facilities are not that much available. So as food banks, we are facing that issue. Where we do not have that investment in logistics and storage facilities, especially the cold storage. And therefore, management of this logistics is become very important for us, that how we can reduce the time lag between when we get the donation of fresh produce and it is distributed and consumed by the community or the feeding programs. So that matching, which we are doing, that assumes great significance, and that is how we are trying to address the situation till we are able to make more investment in storage and logistics.
Thank you so much. And we are reaching the end of our webinar. And I just want us to take us back to the topic that we are discussing. It's not only, it's about the linkages with the health system. It's clear that all the food banks are doing an amazing job in terms of reaching populations that are underserved, that you are contributing to the national, local food security. It seems that there is an opportunity to increase the dialogue in terms of bringing more matching the food that is provided and also the needs of some populations that may be at the dual risk of course, economic disadvantages, but also diet-related non-communicable diseases. Because again, if there is an opportunity to prioritize some populations that have that double risk, maybe an opportunity for dialogue and also for reducing health expenses and many other expenses. Of course, it's clear that the linkage with sustainability is there, and we are delighted to see that you are all considering that in your program. But it seems that bringing the social action with the health system is a little bit still an open opportunity, in some places at least. We thank you so much for your participation. We're inspired, we have learned a lot, and of course, grateful for all the great job that you do, not only in terms of reaching the most vulnerable, but also in terms of bringing volunteers that also in turn become more sensitive to these issues. So it's a broader value to the communities. Thank you so much, and thank you to our moderators. Just as a reminder that tomorrow is our last webinar of this series, Food for Health, where we are going to talk exactly about the last part of this, which is financing. How to make sure that if food is delivered through the health system, someone has to pay for it. It could be through the public government, it could be through fiscal incentives, it could be through philanthropic efforts or private efforts. So tomorrow we are going to discuss that and how to also, of course, make sure that the food itself remains affordable throughout the food supply chain. So I'll see you tomorrow, and thank you again to our participants for sharing your knowledge today.